Well, good evening, Southeast Texas, and thanks for staying up late with us tonight. We start with that 12 News investigation. After serving our country, many veterans are now facing a new fight. Unpaid medical bills where Uncle Sam should have been picking up the tab. 12 News anchor Letitia Kahey reports on the broken system and the victims now left in its wake.
You may have seen the results of the investigation conducted by USA Today that was released earlier this month. This report points out examples of VA actively denying access to community care.
Yeah,
I presume you're familiar with the article.
I am, and we dug very deeply into each of the instances, and obviously can't talk about a lot of that.
One of those instances could include Army veteran Damien Bennett.
I had 11 collection accounts on my credit report from authorized VA community care appointments that was ruining my credit score.
The community care program is for veterans who would like to get care outside of the VA hospital, but it does require authorization.
Dr. Kathleen Kim, who is the San Diego VA Chief of Staff, said physicians sometimes incorrectly try to relocate patients for treatments her hospital can offer, which would be internal, and administrators are regularly educating them to help keep veterans at the VA. And then the direct quote, because of the nature of the Mission Act, the VA is sending a lot of care in the community, and frankly, we're worried that we're not going to be able to pay the bills, end of quote.
Though the veteran is not responsible for payment, it does not stop creditors from calling or sending threatening letters.
Opening up your mailbox is like opening up Pandora's box.
And if ruining credit isn't enough, it's driving away doctors, limiting health care, forcing vets to travel to places like Houston and Lake Charles for help.
I lost all of my community care doctors except one. And the doctors that I lost will not go back into the community care network because the VA did not pay their bills.
Dorothy Mindok is a veteran and veterans lawyer that still fights alongside her comrades, but in a different way these days.
Lots of the guys and gals that go through all of this are really, really sick. And then that leads to the suicides. We lost him that way. He was 26 service-connected disabilities, 53 years old, 35% lung capacity due to war exposures. He was denied oxygen. He was denied palliative care by a voicemail on the telephone.
In 2021, just under $2.5 billion worth of claims were denied in Texas. Just under $500 million were in our area.
This community serves about 25,000 veterans, and we're being left out in the cold. Our community care network is a broken system. I've reached out to the director, I've reached out to my Congressman, Brian Babin, to no avail.
Many vets have to rely on spousal benefits, but others don't have that option and must continue to rely on the VA.
We need the VA. We're not trying to kill the VA, but we understand very well, like he said, there are some people, like Damien Bennett said, there are some great people in the VA. Their hands are tied.
I think we've got a serious problem here that's not going to go away.
Letitia Kahey reporting there. And another big challenge veterans face right now is transportation. Local groups have stepped up to get their brothers and sisters to their doctor's appointments. If you need help or you'd like to help, you can visit our website. We will link you to more information.